A cat purrs at 25 to 50 Hz. That exact frequency range, 25 to 50 Hz, is used in clinical vibrational therapy to stimulate bone density growth, accelerate fracture healing, and reduce inflammation. NASA spent years studying these frequencies as a countermeasure for bone loss in astronauts. Your cat has been administering them to you every night for free. Most people have never thought about what a purr actually is in physical terms. The mechanism is more precise than you might expect. A cat does not produce the sound the way you hum or the way a dog growls. Purring is generated by rapid, rhythmic contraction of the laryngeal muscles, the muscles surrounding the voice box, which dilate and constrict the glottis roughly 20 to 30 times per second. This modulates airflow during both inhalation and exhalation, making purring one of the only mammalian vocalizations produced continuously in both breath directions. There is no pause between cycles. The oscillation runs on the way in and on the way out, without interruption, for as long as the cat sustains it. Most mammals can only vocalize on the exhale. A purring cat vocalizes on every breath, in both directions, maintaining the oscillation through sleep, through nursing, through injury. Elizabeth Muggenthaler measured this precisely in 2001, published through the Acoustical Society of America. She placed accelerometers directly on the skin of domestic cats during purring and recorded both the frequency and the amplitude. The fundamental frequency sat between 25 and 50 Hz, with strong harmonics extending up to roughly 150 Hz. To put that in physical terms, 25 Hz means the laryngeal muscles are contracting and releasing 25 complete cycles per second. 50 Hz means 50. The hum you hear when a cat purrs is the acoustic signature of this oscillation. But the hum is only part of what is happening. Sound travels through air. Vibration travels through contact. The amplitude Muggenthaler measured at the surface of a purring cat ranged from 0.3 to 1.5 G, where G is gravitational acceleration. The same unit used to measure forces on fighter pilots in a high-speed turn and astronauts during launch. 0.3 G is not faint. It is not a gentle tremor you might imagine away. It is a measurable mechanical oscillation strong enough to transmit through direct physical contact, through clothing, through skin, through the muscle beneath, and into the bone underneath. When a veterinarian places a stethoscope on a purring cat, the instrument itself vibrates visibly. If you have a cat nearby, put your hand on its rib cage the next time it purrs. What you feel against your palm is a pressure wave at a specific frequency with a specific amplitude, entering your tissue and propagating inward. That is not poetry. That is a physical description. When a cat curls up on your lap and purrs, it is coupling a 25 to 50 Hz mechanical oscillator directly to your body through surface contact. And that frequency, 25 to 50 Hz, is not arbitrary. In 1957, two researchers at Keio University in Japan, Aichi Fukada and Iwao Yasuda, discovered something about bone that would sit quietly in the scientific literature for decades before medicine caught up with it. Fukada was a physicist, not a physician. He had no background in orthopedics and no clinical reason to be interested in bone. What he was interested in was the electrical behavior of biological polymers, materials like wood, silk, tendon, and bone that have crystalline microstructures. He wanted to know whether biological crystals could do what synthetic crystals do, convert mechanical stress into electrical charge. The medical establishment at the time had no particular reason to think bone was electrical. Bone was structural. Bone was scaffolding. The idea that it might generate its own signals seemed, to most physicians, like a physicist wandering into the wrong department. Fukada and Yasuda took dried bone samples and subjected them to mechanical deformation, compression, bending, torsion, while measuring the electrical output with sensitive galvanometers. What they found surprised even Fukada. The crystal structure of hydroxyapatite, the hard mineral component that gives bone its rigidity and its ability to bear compressive load, generated measurable electrical charges when it was deformed. Compress one side of a bone sample, and that side becomes positively charged. The opposite side becomes negative. Release the compression, and the charges reverse. The bone was converting mechanical force into electrical signal. The physicist, wandering into the wrong department, had found something the physicians had missed entirely. Bone is a piezoelectric material. The same physical phenomenon that makes a quartz watch tick, that powers ultrasound transducers, that produces the spark in a cigarette lighter. Mechanical stress applied to the crystal generates an electrical charge proportional to the deformation. Fukuda and Yasuda had shown that your skeleton does this every time it bears weight. Every step, every jump, every vibration that passes through it generates tiny electrical signals along the crystal lattice of the bone. These piezoelectric charges are not random noise. They serve a specific biological function. They act as construction signals for osteoblasts, the cells responsible for depositing new bone tissue. When your skeleton experiences mechanical loading, the resulting piezoelectric charges tell osteoblasts exactly where to build new bone and along which stress lines to orient the new material. This is the mechanism behind Wolff's law, the principle that bone remodels its own internal architecture in response to the forces placed upon it. The bone literally adapts its structure to match its mechanical environment, and the signal driving this entire adaptive process is piezoelectric. This is why weight-bearing exercise strengthens bones, and why bedridden patients lose bone density. This is why a tennis player's dominant arm has measurably denser bone than their non-dominant arm. The loading is asymmetric, and the piezoelectric signals follow the load. Bone is not a passive scaffold. It is a responsive, self-modifying structure that continuously rebuilds itself based on the electrical signals generated by its own crystal matrix every time a mechanical force passes through it. Your bones are doing this right now, with every step and every vibration that reaches them. So the question becomes very specific. At what frequency of mechanical vibration do osteoblasts respond most strongly? At what frequency does the piezoelectric signal trigger the most new bone formation? In 2001, Clinton Rubin and colleagues published the answer in Nature. They tested a range of vibration frequencies and amplitudes on bone tissue and measured the osteoblast response at each. The result was narrow and precise. Between 25 and 50 Hz, osteoblast proliferation and new bone deposition peaked. Below 20 Hz, the effect dropped off sharply. Above 100 Hz, the stimulation shifted away from bone entirely to tendons, ligaments, and soft tissue instead. The optimal window for triggering skeletal remodeling was 25 to 50 Hz at low magnitude. The specificity of that window is what makes the finding so striking. It is not the case that any vibration at any frequency stimulates bone. Most frequencies do very little. Some do nothing at all. There is a narrow band, roughly 1 octave wide, where the piezoelectric signal from vibration happens to match the resonant sensitivity of the osteoblast signaling pathway. Outside that band, the signal either fails to trigger the intracellular calcium cascade that activates bone formation genes, or it triggers a different cascade in different tissue. Inside that band, between 25 and 50 Hz, the response is strong, consistent, and well documented across multiple independent laboratories. Here is where the coincidence becomes difficult to dismiss. The frequency a domestic cat purrs at, the exact frequency Muggenthaler measured with accelerometers pressed against their skin, sits squarely inside this optimal bone stimulation window. The same frequency range that orthopedic surgeons now program into clinical vibrational therapy devices is the frequency your cat produces when it falls asleep on your chest. Rubin's research continued beyond the laboratory, and this is where NASA enters the story. Between 2001 and 2006, Rubin and his team, Kenneth MacLeod and Stefan Bain among them, conducted a series of studies funded by NASA to address one of the most dangerous medical problems in long-duration spaceflight: bone loss. In microgravity, astronauts lose 1 to 2% of their bone density per month. On a 6-month mission to the International Space Station, that amounts to up to 12% of the skeleton, concentrated in the load-bearing bones of the hips, spine, and legs. The mechanism is the exact reverse of everything described above. Without gravitational loading, There is no mechanical stress on the skeleton. Without mechanical stress, there are no piezoelectric signals. Without piezoelectric signals, osteoblasts receive no instruction to maintain or build bone. The skeleton begins to dissolve itself, mineral by mineral, month by month. On a 3-year round trip to Mars, the bone loss could be crippling. NASA needed to know whether you could replace the missing gravitational signal with vibration alone. Whether a mechanical oscillation at the right frequency could persuade the skeleton to keep building even in the absence of gravity. Rubin's team tested whole-body vibration at low magnitude 0.2 to 0.3 G at 30 Hz, applied for 15 to 20 minutes per day. The vibration was gentle. 0.2 G is barely perceptible, more of a hum than a shake, so faint you might not notice it if you were not told it was there. But the results were consistent and significant. Test subjects showed measurably less bone loss than unvibrated controls. Animal models showed active new bone formation, not just slower loss, but actual new deposition in the vibrated limbs compared to controls. The osteoblasts were responding to the vibration as though the bone were bearing gravitational load. The piezoelectric signal from the vibration was, in effect, substituting for the signal that gravity normally provides. Clinical vibrational therapy platforms based on this research are now prescribed on Earth for osteoporosis patients, postmenopausal women at elevated fracture risk, and people rehabilitating from bone injuries. A session lasts 15 to 20 minutes. The platforms deliver 0.2 to 0.3 G at 25 to 45 Hz. A single session costs $50 to $100. A domestic cat delivers 0.3 to 1.5 G at the surface through direct contact at 25 to 50 Hz. The amplitude actually exceeds the clinical therapeutic threshold, and a cat purrs for an average of 90 minutes per day. If your cat sleeps on your lap regularly, you are receiving roughly 4 to 5 times the vibrational dose studied by NASA. Every day, without equipment, without a prescription, without anyone involved knowing what is happening. From an animal that weighs 9 pounds and is doing this in its sleep. Picture the contrast. A 200-kilogram vibration platform in a rehabilitation clinic, bolted to the floor, powered by mains electricity, calibrated by a technician dispensing precisely metered vibration for carefully timed sessions under medical supervision, and a cat, weighing less than a bowling ball, curled up on your lap with its eyes closed, exceeding every parameter that machine was designed to deliver. The frequency is the same. The amplitude is higher. The duration is longer. The cat does not know any of this, but the vibration does not stop at bone. And this is where the picture changes. Every vibration that enters your body from a purring cat, the oscillating pressure wave that generates piezoelectric signals in hydroxyapatite, passes through every layer of tissue between the skin surface and the skeleton. It does not skip the soft tissue to reach the bone. It passes through all of it, and as it does, it produces measurable biological effects at each layer it traverses. Vibration at 25 to 50 Hz causes local vasodilation. The capillaries in the contact zone dilate in response to the oscillating pressure, increasing blood flow and perfusion to the surrounding tissue. More blood flow means faster oxygen delivery, faster nutrient transport, and faster clearance of metabolic waste from the area. If you have ever noticed that the spot where a cat has been lying on your lap feels warm after it stands up, warmer than body heat alone would explain, this is part of the reason. The vibration has been dilating your capillaries for the duration of the contact. Zheng and colleagues demonstrated in 2019 that 50 Hz vibration accelerates wound closure in animal models, not by healing the wound directly, but by increasing fibroblast activity, increasing collagen deposition, and stimulating angiogenesis, the formation of new blood vessels at the wound site. The vibration creates the conditions under which the body repairs itself faster. Low-frequency vibration at these same frequencies also suppresses pro-inflammatory cytokines, specifically interleukin 1 beta and tumor necrosis factor alpha, while increasing anti-inflammatory markers. This has been measured in both animal models and human clinical trials. The vibration modulates the local inflammatory response, damping it down without pharmaceutical intervention. And there is a pain component. Vibration at 20 to 50 Hz activates a class of mechanoreceptors in the skin, Meissner's corpuscles, that are optimally sensitive in precisely this frequency range. When these receptors fire, they compete with pain signals traveling along the same spinal pathway. This is the gate control mechanism first described by Ronald Melzack and Patrick Wall in 1965, in what became one of the most cited papers in the history of neuroscience. The reason rubbing a bruise makes it hurt less, the reason a vibrating massage pad applied to a sore muscle provides relief. Mechanical stimulation of touch receptors closes a neural gate to pain signals at the level of the spinal cord. A cat purring against a sore knee or an aching joint is activating that identical gate. The same mechanism, the same frequency range, the same neurological pathway. Bone repair, vasodilation, accelerated wound healing, inflammation suppression, and pain gating, all documented at the exact frequency a cat produces through laryngeal oscillation when it sits on you and closes its eyes. This raises a question that has genuinely puzzled veterinarians for decades. Everyone knows cats purr when they are content. But cats also purr when they are injured. They purr when they are frightened. They purr during labor. They purr when they are dying. A cat hit by a car lying on the side of the road with broken ribs will purr. A cat in the final hours of kidney failure will purr. If purring were purely an expression of satisfaction, a feline equivalent of smiling, none of those contexts make any sense. An animal in the process of dying does not smile. Something else is happening. Morgenthaler proposed the self-healing hypothesis in 2006, and it reframes the entire behavior. Domestic cats are among the most sedentary mammals on Earth relative to their body size. They sleep 12 to 16 hours a day, longer than bears in hibernation, longer than sloths. In virtually any other mammal, that degree of inactivity would produce significant bone density loss, joint deterioration, and muscle atrophy within months. Astronauts lose measurable bone in weeks under similar conditions of reduced mechanical loading. Yet cats suffer remarkably few bone-related diseases compared to dogs of similar size and activity level. Rates of osteoarthritis and stress fractures in domestic cats are significantly lower than in comparably sized canines. The discrepancy has no obvious dietary or genetic explanation. Something is maintaining their skeletal integrity despite the inactivity. The purring vibration, 25 to 50 Hz, applied continuously to the cat's own body for hours every day, may be precisely that mechanism. Not communication and not contentment. Maintenance. A low-cost, self-administered vibrational signal that stimulates osteoblast activity and preserves bone density during the long sedentary hours between hunts. An injured cat that purrs may not be expressing comfort. It may be running a repair program, applying therapeutic vibration to its own fractured bones, its own torn tissue, using the same frequencies that Rubin's laboratory would not identify as optimal for another 3.5 centuries after cats evolved them. Purring costs almost nothing metabolically. Laryngeal muscle oscillation requires far less energy than locomotion, or even ordinary vocalization, making it an extraordinarily efficient maintenance mechanism. A way to apply therapeutic vibration to your own skeleton for hours at a time without burning significant calories. And the trait is not unique to domestic cats. Cheetahs purr, pumas purr. Bobcats, ocelots, and servals purr, all at similar frequencies, despite being separated by continents and millions of years of divergent evolution. The common ancestor of all purring cats lived roughly 10 to 15 million years ago. That means this trait, this specific frequency range, this specific laryngeal mechanism has been maintained by natural selection for longer than the Himalayan mountains have been at their current height. That degree of conservation across that many lineages and that much geological time means the trait was held under strong and persistent selection pressure. Whatever 25 to 50 Hz vibration does for a feline body, it mattered enough to preserve across every branch of the small cat lineage for longer than most species on Earth have existed. Beyond the musculoskeletal system, the effects extend into the nervous system itself. Petting a cat for 10 minutes reduces circulating cortisol, the primary stress hormone, by 10 to 15%. It increases oxytocin, the hormone associated with bonding and social trust. These measurements come from Beetz and colleagues, published in Frontiers in Psychology in 2012. But the purring frequency adds a dimension that touch alone does not provide. 25 to 50 Hz vibration and low-frequency sound can entrain brainwave activity toward alpha and theta states through subharmonic neural coupling. Alpha waves at 8 to 12 Hz correlate with calm, focused attention. Theta waves at 4 to 8 Hz with deep relaxation and the threshold of sleep. This is not metaphorical. Brainwave entrainment to external rhythmic stimuli is a well-documented neurological phenomenon. The brain tends to synchronize its oscillatory activity to periodic sensory input, especially at low frequencies transmitted through both the auditory and somatosensory pathways simultaneously, which is exactly what a purring cat provides. Heart rate variability increases during sustained cat interaction, a reliable physiological marker of parasympathetic activation, the rest and digest state that counterbalances the fight or flight response. In 2009, Adnan Qureshi and colleagues published a 10-year longitudinal study in the Journal of Vascular and Interventional Neurology. They tracked 4,435 participants over a full decade. Cat owners had a 30 to 40% lower risk of death from cardiovascular disease compared to people who had never owned a cat. 30 to 40% lower cardiovascular mortality, sustained over 10 years in a study large enough to adjust for the standard confounders. Let that number sit for a moment. 30 to 40%. Statins, the most widely prescribed cardiovascular drugs on Earth, typically reduce cardiovascular mortality by 25 to 35%. A cat on your lap, purring at 25 Hz, is in the same range. One component of that mechanism is a 25 Hz vibration administered nightly by an animal that weighs 9 pounds. The animal is not trying to lower your blood pressure. It is trying to sleep in a warm place. The physics does the rest. If a cat is near you right now, let it settle on your lap. Put your hand flat against his rib cage and hold it there. Feel the vibration. Close your eyes for a moment and pay attention to what that vibration feels like against your palm, not as a sound, but as a physical oscillation entering your body. That is 25 to 50 Hz. That is the frequency Fukada's bone crystals responded to. That is the frequency Rubin's osteoblast proliferated at. That is the frequency NASA spent 6 years and millions of dollars studying. What is entering your body through that contact is a mechanical oscillation at 0.3 to 1.5 G amplitude. It is propagating through your skin, through the muscle beneath, and into the bone below that. Your bone is generating electrical charges in response. Your body is building new bone tissue along the vibration lines. Your capillaries are dilating. Your pain signals are being gated. Your inflammation is dropping. Your stress hormones are falling. Your heart rhythm is shifting. Your brain waves are slowing towards sleep. All of this is happening. All of it is measurable. None of it requires either of you to understand it. Clinical equipment that replicates this effect weighs 200 kilograms and costs $15,000. It delivers 0.2 to 0.3 G at 30 Hz for 15-minute sessions, prescribed 3 times per week by a licensed physiotherapist. Your cat delivers 0.3 to 1.5 G at 25 to 50 Hz for 90 minutes a day. It does this while sleeping. It has been doing this every night since you brought it home. It does not know it is healing you. The physics does not require it to know.